So before I even enter the room, I'm going to gather my supplies and make sure that I'm in my uniform, which you see I am in a second. Then I'm going to knock on Lindsay's door.
Come in.
Okay, I'm going to enter the room. Hi, Lindsay. My name is Jacqueline. I'm one of the nurses working down here today. We're going to do a head-to-toe assessment if you're okay with that.
I'm okay with that.
Okay, so first thing I'm going to wash my hands and get an updated set of vital signs on her. Vital signs are normal, and then I'm going to ask her, are you in any pain today, Lindsay?
No, I am not.
Okay, so she's not in any pain. Washed my hands. I'm going to close the door to provide privacy. And then I'm going to, Lindsay, can you tell me your name and date of birth?
Lindsay Hummerding, 10/26/03.
So I'm checking her wristband to make sure that the information she gave me was correct. And it is. Lindsay, do you know where you are today?
I'm at the St. Cloud Hospital.
And do you know today's date?
December 9th.
Okay, and what year?
2018.
Okay, so Lindsay's oriented to person, place, and time. Her speech is clear, it's not garbled. She, when you look at just her general appearance, she doesn't look disheveled. She looks clean. She's in appropriate clothing for the weather. She's not confused. She's speaking in an appropriate tone and volume. So Lindsay, to start with your head-to-toe assessment, I am going to start at your head, okay? So the first thing that I'm going to do is feel her head here. Are you having any pain?
No, I'm not.
I'm checking her head for any lesions, bumps, parasites. I'm checking her hair distribution. Does she have any bald spots anywhere? It all looks normal. She's not in any pain. Her face looks symmetrical. Then I'm going to move down and check cranial nerve number 5, which is the trigeminal nerve, and touch her face. Do you feel me touching Lindsay on both sides?
I do.
That's equal?
Yes.
Okay. And then that's also checking cranial nerve 7, which is the facial nerve. I'm going to check that as well by having her lift your eyebrows for me, Lindsay. And then can you open your mouth and smile? Can you frown? Okay. Can you close both eyes a couple times? Good. Stick your tongue out. So that all moves symmetrically. It doesn't do one or the other. So that, like I said, was checking cranial nerve number 7. Then I'm going to move to her eyes, Lindsay. So first just checking for any discharge. Is her sclera reddened? They both are the same. No abnormalities there. Then I'm going to check her pupils. So this is checking cranial nerve number 3, the oculomotor. So Lindsay, I just want you to take a look at my nose, and I'm going to shine a light in your eyes, okay? Good. Other one here. Good. So I'm checking her pupils with that. So you say the pupils are equal. They're both the same size. They're round. They're reactive and to light. So as I shine the light in them, they get smaller. I would say that they are both a size 5 right now. And then I'm going to have her follow my pen light. This is checking cranial nerves 3, 4, and 6. So again, 3 oculomotor, 4 the trochlear, and 6 the abducens. This is checking for eye movement. So I just want you to follow my pen here. And as I get closer, I just want you to follow it, okay? So that's the accommodation part of Perla. She's able to follow it, and her eyes constrict. Then I want you to follow my pen as I move, okay? So we're going to go across. Good. So she's able to follow in all directions. That's testing those muscles of the eye. Then lastly, we're going to check cranial nerve number 2, the ocular nerve. So I want you to close your eye like that. Yep. And we're going to put our hands both out. And can you tell me if you see your hand in my hand?
Yes.
Okay. And then we're going to do the other side. Like that. Do you see me moving? Do you see you moving?
Yes.
Okay. That's the accommodation test, testing for eye function as well, your peripheral vision, and that's good. Next, I'm going to move to ears. I'm going to look into both ears. There's not any excessive drainage or lesions. Are you having any ear pain right now?
No, I am not.
Checking for excessive cerumen in both ears. They look good. Then I want you to close your eyes, Lindsay. And I want you to tell me which ear you hear this in, okay?
Left
Okay.
and right.
And that's checking cranial nerve number 8, the acoustic nerve. Then I'm going to move to her nose. Looking at, you can open your eyes. Looking at it, her nose is symmetric. It doesn't deviate to one side or the other. I'm going to take a look up into her nares. So can you look up for me? Both nares are clear. They're not deviated. She doesn't have a deviated septum. Can you close one nostril and breathe through it? Okay, and then the other side. Right now I know she has a runny nose. She told me that earlier, but normally it would be patent. She should be able to breathe through both sides. You do have a runny nose right now, correct?
Yes, I do.
Okay. So that's good. Then we're going to move to her mouth. Just looking at her mucous membranes, her lips are pink. They're not dry. They look moist. And I want you to open your mouth and say, ah.
Ah.
One more time.
Ah.
So uvula is midline. It rises as she says ah. Can you open up again? Just looking at her teeth, dentition. I don't see any abscesses. She doesn't look like she has a ton of cavities. Her mouth and tongue are not dry. They're wet and pink. And then I'm going to have you, Lindsay, I'm going to touch your throat, and I want you to swallow for me, okay? Okay, I know this is kind of hard. I can feel her swallowing. That and saying ah is checking cranial nerves 9, 10, and 12. So the glossopharyngeal nerve, the vagus nerve, and then the hypoglossal nerve. That all kind of runs your mouth and your swallowing. Lindsay, I want you to stick your tongue out one more time. Beautiful. You can move it from side to side. Okay, good. That's all checking those nerves. Then I'm going to move to lymph nodes. I'm just going to touch your face here, okay? So I'm going to palpate lymph nodes. We have submental, submandibular, tonsilary, and then in the front here we have preauricular, postauricular, occipital, and then we have posterior cervical, anterior cervical, and supraclavicular. Those are on lymph nodes. They shouldn't be palpable. None of them felt hard. She kind of does back here a little bit, but I know she's kind of sick. But otherwise, you shouldn't be able to palpate them. If you do, they should be freely movable. They shouldn't be hard. None of that was tender, correct?
No.
Okay, beautiful. Then I am going to check cranial nerve 11, which is the accessory nerve. I just want you to shrug your shoulders against my hands. Up like that. Way up. There you go. Good. And that's strong. She's doing that equally on both sides. Then I'm going to touch your face. I just want you to push against my hand. Okay. Other side. Good. Those are both strong. So that's cranial nerve 11. Then I'm going to move down, and as you know, I'm doing the assessment, I'm going to look at her as she's breathing. Is she breathing at a regular rate? Which, yes, she's not hyperventilating. She's not having really shallow breaths. Her chest is normally rising and falling. It's not doing something weird on the one side or the other. I can look and physically see she's not using accessory muscles. The rate and rhythm and depth are all normal. I inspect her thorax. She's at a 2-to-1 ratio. She doesn't have a barrel chest. 2-to-1. The chest is 2, and then down to the waist is 1. I can next visibly see that, oh no, I want to listen next. So now I'm going to listen to your lungs, Lindsay, okay? So we're going to do 6 on the front first. So as I move my stethoscope, I just want you to take deep breaths in and out, and I'll tell you, okay? So we're going to start up here. Deep breath in. Okay, and out. Make sure you keep your mouth open. And again. Okay. Again. Okay. Again. Okay. Again. Okay. I'm going to move to the back here. So I just want you to turn so that she can see you kind of. We're going to do 6 on the back too. So I'm checking each as I move across the same level to listen to each lung. In. Okay. Okay. In. One more. I'm going to check under both sides here. So I just want to go up here. In. Okay. Big deep breath in. Okay, and then you can turn. I'm just going to get to that other side. Beautiful, that's good. Good. One more. So I'm surprised. I know she has a cough, but her lung sounds do sound clear and equal bilaterally throughout all lobes. Then I'm going to listen for tactile fremitus. So I'm going to just put my hands on your chest, and as I move down, I want you to just say the words 99, okay? So we're going to start at the top.
99. 99.
Louder.
99.
Okay.
99.
Okay.
99.
Okay.
99.
One more.
99.
Okay, so that feels normal. That's checking for if she's got any gunk in her lungs or any fluid. You'll sometimes feel a little different. You're feeling for the vibrations there. That feels normal. Next, I'm gonna palpate her carotid arteries on each side, just one at a time. Good. That's strong on that side. Strong on that side. Rhythm is regular. Then I'm going to listen to both of those carotids with the other side of my stethoscope here, listening for any rushing of bruit. And I want you to hold your breath. Okay, take a deep breath. You can let it out. And hold your breath. Good, I can hear both of those. They don't have any abnormal sounds or the bruit, the whooshing, so that's normal. And then next I'm going to listen to her heart. So we're going to start on the right side, the second intercostal space. So sorry, this might hurt, but we're feeling 2 down. And this is the aortic artery on this side. So we're going to listen. Good. And that's just right on the clavicular line here. We're going to move, over to the left side, the pulmonic side, pulmonic artery, in the second intercostal space. Good. Her heart's racing. She's a little nervous. Then we'll move down to the third intercostal space, which is Erb's point. Okay. Fourth intercostal space, which is the tricuspid. And lastly, it's kind of hard on ladies, it's underneath the mitral, fifth intercostal space. This is also where we measure the apical pulse. And I can hear all of those heart sounds. There's no extra noises, no rubbing, no friction, nothing that would indicate a heart murmur. They're all strong. Okay. Then I am going to, do you have a cough right now? Yeah. Normally, obviously, a normal finding would be that you don't have a cough. I'm going to actually palpate for, to feel you breathe in and out. So just breathe, okay, and again. So I can physically feel that chest rise and fall that we were looking at earlier. Then what I'm going to have you do is we're going to have you lay down, okay? And I'm going to do abdominal stuff here now, Lindsay, okay? So just let me know if anything hurts you. Very first thing I'm going to do is inspect. That's what we do first. Just looking at her abdomen, it's flat, it's not round, it's not protuberant, it's not scaphoid. She doesn't have any obvious, anything protruding, any hernias that I can see. So then next I'm going to auscultate for vowel sounds. Starting at the right lower quadrant here. I might push a little hard, let me know if anything hurts. Okay, and I can hear sounds, so I'm just going to move throughout the abdomen from right lower to right upper. Okay. Okay. Good. Vowel sounds are active in all 4 quadrants. If I were to not hear something, I would listen for 3 to 5 total minutes before I would either say that they're diminished or absent. Next, I'm just going to palpate. I'm going to go in the same way in which I just listened. Okay, so you let me know if there's any pain. Okay. So I'm feeling her abdomen for any tenderness, any distension. Her belly isn't hard, it's not distended, didn't have any pain. That's all normal. Then I'm just going to ask you a couple questions, Lindsay. When was the last time you had a bowel movement?
Today.
Okay, was it hard, formed, or soft?
Formed.
formed, and what color was it?
Brown.
Brown, okay. And then any urinary problems, like pain when you urinate, frequency, hesitancy, anything like that?
No.
No? And are you pregnant right now?
No, I'm not.
Okay, good. Then I'm going to move to pulses here. So I already felt the carotid. As we listen to these pulses, we're going to obviously compare them from right side to left side. So I'm going to start with the radial pulses here. Okay, those are both strong and present on that side. You can obviously feel femoral, but we're not doing that for this head show. Then I'm going to move down to popliteal here, so behind the knees, which are hard to feel in jeans. Okay. Those are strong and equal bilaterally. We're going to move down and do posterior tibial, so back here on the ankle. Can you see? Okay. Those are strong, bounding actually. And then up here on the top, the dorsalis pedis. Those are present and strong as well. Then when I'm down on the legs here, I'm going to check capillary refill in her toes. Cap refill is less than 2 seconds. Her feet are warm. She doesn't have any edema or pain. No abnormalities in her legs or lesions. 0+ edema. If she had some, you could rate it on a scale for pitting edema. All right, Lindsay, then I know you're ticklish, but we're going to feel for some reflexes here. So I'm going to check her foot reflex. Going up like that. Up like that, which is good. And then we're going to check her for ankle clonus. So I'm going to check both of these. All right, you're going to do it on both sides. I just want you to be relaxed here. Okay, relax. So she's pushing up on me as I do that. Relax your leg. So that's normal. She's having that reaction. Then I'm going to move up and check her capillary refill in her hands. Cap refill is less than 2 seconds. Her hands are warm. Arms are warm. She doesn't seem to have any extra edema. Are you able to feel me touching on both sides?
Yes, I am.
On the legs too, you can feel me down here.
Yes.
Feel me on your feet.
Yes.
Okay, that's good. I want you to squeeze both of my hands here. Okay, I want you to push up. Okay, push down. Okay, squeeze my hands again. Pull me towards you. Okay, push me away. Okay, same thing on your feet here. I want you to push up on my hands and then push down like you're driving. Okay, good. And then I'm going to check for range of motion. So I want you to bring your right knee to your chest as far as you can, okay? And then your left leg to your chest. Good. Can you move both your ankles in a circle? Okay. I want you to move your head to the right, head to the left, not up and down. Okay. And then lift both arms up over your head and then down. Good. So that's checking range of motions and strength for all of her extremities and her head. Then what I want you to do, Lindsay, is we're going to sit at the edge of the bed again, please. And I'm going to check her deep tendon reflexes. So we're going to start with the triceps reflex. First I'm going to feel for the tendon. Then I want you to just relax your arm. I don't have a reflex hammer, so we're going to use this, but I could use my stethoscope. Just want you to relax. And we're trying to hit that. You don't have to fake it if we don't get it, but we're watching for this arm to move forward, and I'm actually going to use my stethoscope here. Then we're going to do the biceps. So we're out like this. Relax your hand. And we're just looking for the twitching of this muscle up here. You're hitting your finger and not her with the reflex hammer. Then we're going to do the brachioradialis. So I'm feeling for the nodule here. You move up a little bit. Let your hand go freely. And we're watching for twitching up here, and then the thumb will kind of do its movements. I obviously still need a little bit of practice on these. Normal, you don't want them to be hyperactive. And then we're going to move down to the popliteal. So I want your legs to just be swinging, which they are. Okay. And once you hit it, her legs should swing forward on both sides here. On the other side. Okay, good. I'm going to do the triceps on that side again, this side. So I want you to relax your arm. Feel for that tendon. Okay, relax, relax. Ooh. Okay, and then we'd move down to the biceps. Same thing with the reflex hammer. Okay, and then brachioradialis. I want you to relax. Feel for that nodule. Move up a little bit. Relax your hand. Okay. Then we're going to move it down, and I'm going to do the Achilles. So way in the back here. I'm just going to relax your leg. I'm going to hit, and we're going to watch for this to contract up here. Okay, and here. Okay. Then what I want you to do, Lindsay, is I'm going to have you stand up. I want you to close your eyes with your hands at your side. This is the Romberg test. Testing for, balance. She is doing a good job. Usually if somebody's got some abnormalities, they'll do some swing. They wouldn't be able to stand normally. I want you to turn around and just bend forward a little bit. That's good. I'm just checking here. Any pain?
No.
Spine is aligned. There's no abnormality. I can't talk. Abnormalities in the cervical spine up here. And no pain. Okay. Then I just want you to take a couple steps back and forth here. You don't have to get her on video walking. I'd watch her walk for a longer distance and check her gait. So her arms are both swinging normally side to side. She's not dragging a leg. She's standing upright. Head is forward. That is all normal for her. Then we'll have you crawl back into bed, Lindsay. Make sure you're in a comfortable position. You're okay like that?
Yes.
Okay. Is there anything else I can get for you right now?
No, thank you.
No? Okay. So that concludes our head to toe assessment with you. I can come back if there's something else that you need. You just let me know, okay?
Okay.
Okay, so then I would wash my hands and then go document, and that's everything.